people died of tuberculosis in 2021, according to a report by WHO. It is the 13th most leading disease to kill people and second most infectious disease after COVID-19. Tuberculosis has been killing people around the world wide and has been reported one of the most infectious diseases. Today we have Dr. Neha Rastogi with us, who is going to explain us about the tuberculosis and how difficult it is to make it easier for the people so that they can come and talk about it. So when we talk about tuberculosis, ma'am, normally for people, वो बस एक खांसी है, or maybe a lot of people are, I think, unaware of the fact that tuberculosis is actually a very infectious disease and it can lead to a death also. But sometimes when people are, I think, suffering from cough or normal khasi, all they can do is, without even prescription, cough syrup ले ली, gargle कर लिया, the normal house remedies or whatever the medicines you have been eating since very long. So when we talk about tuberculosis, what exactly is tuberculosis and what is what different kind of tuberculosis do we have?
Right. So first of all, TB is as oldest a pandemic Indian nation has witnessed. I mean, as old as we talk about COVID these days, but trust me, this is one of the most deadly and dangerous, even more than COVID. As far as the types of TB is considered, so post-COVID, we have seen not only the lung TB, but also the other forms of TB, specifically the gland TB, the lymph node TB, abdominal TB, we have a brain TB, we have a bone TB, joint TB. So TB can affect practically every part of the body. It's just like we are more worried and concerned about the pulmonary, that is the lung form of TB, because that's the most easily transmissible to the other people and being a threat for both, not for only yourself, but also for your family because of its communicability. As far as the symptoms of TB is considered, as I mentioned, there are different forms and different sites, so that depends upon the site to site. So talking most commonly about the lung form of TB, like you have rightly mentioned, the cough is the major symptom. And in cough also, because this is a season, this is a winter season, a lot of viral infections takes place, flu and COVID. So their cough can be in that also. So there's an overlapping symptom. But if the cough keep persisting for almost 2 weeks or beyond 2 weeks, you have a high grade fever which is like not going even after 7 days, 10 days, you have a weight loss, food appetite loss, and started developing more of a breathing symptoms. And the cough kind of, because mostly the viral infections have more of a dry cough. If you have a sputum productive cough which is yellow or greenish red in color, start thinking you're clocked towards the TB. Get yourself diagnosed at an earliest.
So when we talk about tuberculosis, we talked about it's an infectious disease. Is it transmissible to person or it's just not transmissible disease?
So definitely it is a communicable disease because it can be transferred from person to person through the air. If I'm talking, sneezing, laughing and no contact is being there, no mask precaution is there, lung TB can be fully transmitted to the other person.
So when we talk about transmissibility, then we talked about symptoms, but can you list the symptoms, like precisely symptoms about if somebody wants to see a doctor and it's a high time that you should see a doctor, it's not a normal cough or a normal khasi. So what are the symptoms that should be precisely seen in anybody, be it from a younger age person to an older age person?
True. So like I said, the TB is of different parts. So if I talk about only the lung TB, there you have a fever which is low grade to high grade for 2 to 4 weeks almost. You have a cough which is initially beginning, it's dry, but then it becomes wet, eventually becomes more hacky and more volume in nature. Third is probably the shortness of breath, breathing difficulty starts ensuing if it is not taken care. And plus minus, many a times people do come up with the blood in the sputum or blood in the cough as well. So these are the common symptoms. Along with that, the weakness, fatigability, loss of appetite and loss of weight. So these all complexes make specifically for the TB of lung. Apart from that, other areas, for example, if you have a brain TB, fever, headache. Sometimes people present us with the seizures. And sometimes even the worst case scenario, they come up with the coma state or an altered state. Same way, if you have a gland TB, people started showing up the weakness, low grade fever, and particularly when we see young people with the lymph node of the neck area, they start observing some swelling kind of a thing, which increases every day for almost 2 weeks and 3 weeks, and then they land up that they have started feeling some kind of a nodule, which turns out to be the lymph node TB. For abdominal, the most common symptoms are loss of weight, loss of appetite, vomiting, constipation, sometimes blood in the stools. So based upon your area specificity of symptoms, you have different kind of symptoms.
So when we talk about TB, why would a person, a healthy person also, the reporters have been like, not only the person who work under some difficult situations, but the people who are healthier also can get the TB. What can be the common causes if somebody is having TB? Or be it like, TB not in just the lungs, but any part of the body.
So in India, there is something called as a latent TB. We are like born with the TB. So 95 to 96% of Indians have already a TB infection at the birth time. Okay. So most of them gets reactivated in the due course of time. Even a healthy person who comes in the contact knowingly or unknowingly with the ex-person who has some form of TB, specifically the lung TB, anywhere at any point of contact in time, they can acquire that TB. TB is not only linked with the low immunity, but also a poor state of nutrition. And when I talk about a poor state of nutrition, that doesn't only mean an undernutrition, a malnutrition. Even if we more of the junk foods, no healthy diet, no balanced diet, no high protein diet, working in a full AC atmosphere where the opposite person to you keeps coughing for like years altogether, you are also liable or bound to have a TB.
Does it also happen for the people who goes under, lot of extreme dieting and lot of things? Because that is also where you're not getting the proper nutrition.
Absolutely. So the idea is that the undernutrition or a dieting is only a form to just, have a weight based. It's more of a cosmetic thing. I would rather request to have a dietary modification. Make it more sustainable so that your medical fitness doesn't get hampered. So definitely is one of the, because you just starve totally. You don't have a healthy protein, you don't have any supplements, and then eventually your immunity goes off. And when you come in the contact, like I said, with being in this professions or wherever you are going and working, if you unknowingly come in contact with the person, you are more susceptible to that.
So when we talk about the treatments, is TB curable or is TB manageable with the medicines but not curable? Like, is it completely treatable and a person who has acquired a TB infection can be cured properly?
Yeah. So treatment of TB is basically the two-way. One is a drug-sensitive TB and one is a drug-resistant TB. Luckily, our drug resistance rate are not that high, but still it fares somewhere around 11 to 20%, which is still a big number. Every 1/5 of the person will have. Cure rate again depends. For any infectious disease, it depends upon when you walk in. So it's always a window for us. So whenever you are coming with, say, one site TB, which has been fully diagnosed, and when I talk about diagnosis, in the 21st century, in 2023, let's all pledge that early diagnosis and early treatment should be the key for TB Mukt Bharat, I should say. So whenever you have an early diagnosis ready and you have a one-side TB with medicines taking properly, no failure in the medicine, the treatment duration is very less also, and also it's fully curable.
So when we talk about tuberculosis and its infectious, how it spreads, is there any specific age group or specific group of age where it is more affected or say activates again while in coming in the contact with someone?
So TB is one disease which is, no bias by age. As far as the elderly concerned, they are more liable because of their poor immune functions and different other illnesses like diabetes, hypertension. Young, they are more affected because they step out more, they come in contact with the other people more. So as far as the age group is considered, I would like to say that the extra lung forms of TB other than lung are more commonly we have seen in the younger age group, like the lymph node and the abdominal ones. As far as the lung TB is considered, because the older, specifically males, they have a chronic smokers, or the women of the houses were used to have some chulas, exposures. So those are more prone to the lung-based TBs. So this is the only parity, but otherwise TB can affect any form of age.
Okay. So as we talked about TB, how a person can diagnose on an early stage, very early symptoms where now you have to see a doctor, and then what kind of treatments are given to the people who are affected. They have been diagnosed, and now what kind of treatments are given to them?
So thanks to our Indian government, the NTP program, they have made this strategy very, very simple. So as we have mentioned that the symptoms are very overlapping again. Weakness, fatigue, loss of appetite are certain very subjective symptoms. So I would say that earliest symptom is the earliest you can come to a doctor. So if you have symptoms like fever, even if it is like a low grade fever, you are only a feverish feeling, but that is also ongoing for say a week or two. So 10 days, 7 to 10 days should be a cutoff. That beyond that, any symptom for that matter is existing, either a weakness or a fever or a loss of weight, loss of appetite, or low on energy even, cough, abdominal pain, headache, start seeing a doctor. And then eventually even a lower backache. So many a times we see patients coming with the lower backache for 2 months. They have taken supplements, vitamin D's, painkillers, but we get an MRI done and there is a TB right in the spine sitting. So the idea is early to pick up that. As far as the early picking up is considered, the diagnosis also depends upon the area specific. So if it's like a lymph node, we better take a sample. For the lung, if it's a productive cough, we take a sputum sample. If it's a dry cough, we prefer to do a bronchoscopy. If it's an abdominal and it's a heavily colonized area, like heavily fully intestines are involved, we prefer to do a biopsy using the endoscopic techniques. Same for the urinary TB, we prefer to take a urine sample. So based upon the site specific, we do a sampling. Treatment is also very simple thanks to government. We have the drug sensitive and drug resistant, and we have a program based management.
Okay. So when we talk about the cough and the specific age group of people, does people who are working into some industrial areas between the smoke and a lot of pollution which is caused by fire, and say anything which is caused by burning of something and then you're inhaling it, are they even more more towards prone towards the tuberculosis?
Actually in that scenario, nowadays the air quality index is such bad that practically every person is prone to that. It's because those chemical things or fumes, they causes a local lung injury. So when you are working, for example mining people or coal worker people or in a cement factory, when you keep working, the particles gets depositing. So your lung capacity starts getting compromised. And the lesser is the lung effect, there will be more, the secretions which we spit out usually, it's a usual thing, you are not able to. They keep collecting and the exposure will be more, and hence the vulnerability of a disease to come early and spread is more.
Even that is possible if somebody is a daily chain smoker or a daily heavy smoker?
Absolutely. So smoking actually increases the risk of having a tuberculosis by 15 to 20 times as compared to their normal non-smoker counterpart. And when I say a smoker is not only dangerous for himself or herself, but the other inmates who are passive smokers.
Okay. So has been there any kind of development in tuberculosis treatment? Because I think half of the people think that tuberculosis is only a disease which can be caused through lungs, or it's a cough disease. But as you mentioned that it can be in any part of the body, say joint, spinal cord, or your abdomen. So has there been any kind of a development in past few years in treating TB, and how successful it has been for you to treat people through that diagnosis, or the kind of treatment that has been developed?
So yes, TB is one area which has been very dynamic. And even after COVID, lot of our government energies and research has been channelized to TB. TB treatment has been really advanced, and with the help of TB Mukt Bharat Abhiyan, it is being given to even the poorest of the people. Okay. Apart from that, the nutritional support, even nowadays financial support is also being given to the people with free of cost treatment. TB regimen, which was initially used to be said कि अगर drug resistant TB है, so the treatment will be say 18 months, 24 months, उससे पहले इलाज नहीं हो सकता. WHO and even now in India from 2023 onwards, we are treating a drug resistant lung TB in 6 months also. Gone are those days where injections were the important source of a treatment. Abhi everything is very oral, very easily being given and very easy to administer to the people. Duration of treatment has shortened. Effective drugs have been incorporated every year to increase the yield and to increase the response rate. Diagnostic front has been wonderful. So these days we have digitalized artificial intelligence based diagnosis of TB to pick up a TB in some XYZ village so that can be easily being picked up right in time, diagnosed and treated. So TB is an area which has been working fabulously on the development front. Vaccines of TB has been a huge success. Good trials have been upcoming. And more than that, the tracking technology has been these days wonderful to pick up more and more TB cases.